My name is Jason. I'm a Picc Nurse, and I'm going to show you how to prep the room for your patient. We're going to do it just like I do it at every facility. First, though, let me say, I walk into the room, no gloves. I do my paperwork, no gloves. And one of the ways I accomplish that is I put my mask and my glasses on in the back of my car. That way I'm walking into the facility with my glasses on, my mask. Otherwise, and you'll see as I open up the kit and set this process up, otherwise, you have to figure out how to get your mask on after you've touched the patient with your gloves. Do you really want to swap another pair of gloves? So in this video, I'm going to show you how I set up a room. It takes me pretty much the same amount of time every time. I'm done with the procedure, in and out for a midline in less than 25, 35 for a pick. I'm going to talk you through my entire procedure. This video will seem like it takes forever compared to what it's like when I walk into a room. I'm going to do it straight through. I don't get it perfect every time I walk into a room. And while every room may be different, they're really not that different. Some have beds that don't go up as high, some are on carpet, some are nicer facilities. Sometimes you got to do a seated patient, they got to go find the patient. Listen, beds don't work, wheels don't, you got to pull it. Not everyone, the head, the COPD, the missing a foot, the whatever, you know what I mean? Like, there's lots of variances, but there's only 4 walls and 4 corners in a room, so there's only so many positions the bed can be in. So I'm just going to take you through as if I was walking in with a nurse from the facility. You know, the nurse will knock, and I'm telling you right now, I don't let them turn the lights on. If the lights are on, that's fine, I'll leave them on for the moment, but no lights. I immediately de-escalate, tone down the situation. So the nurse and I walk in. The nurse will usually greet the patient. They know the patient. I'll step around to the foot of the bed, and the LTN will follow me, or the RN will follow me. And I'll say, now paperwork's filled out, right? I got my face sheet, everything's ready to go. I reviewed my consent. I reviewed the date, order verified. I know what's going in the midline to make sure it's not going to be Venco. So I am ready to shift as much responsibility to the nurse at the facility as possible. Ready? Seriously, even though it's your responsibility, you got to be ready to shift. Hey, look, I tried as hard as I could. I ask the patient's name, and I point to it on my form while the nurse looks at it. I ask the patient their birthday, if it's possible, and it usually is. So next, we end up with my procedure timeout. So I start, patient, and I look right at the nurse, right, I put the date, so I got 10:21 and the time 1400 right there. So I got my procedure timeout. They've walked in the room with me. So room number, self-identification, patient's alert and oriented. I circle the procedure and I say, we're going to do a midline. I have no restrictions, right? There's no pacemaker on one side, or a lumpectomy, or you know what I mean, or dialysis. And then we go into the limiting conditions, and I just say, the patient does not have an upper extremity DVT. They are not on dialysis. They're not taking Coumadin. They don't have a pacemaker, no mastectomy. I put my initials. I turn my, that's why I have everything on a clipboard. Bam! I put my pen on it, and I just let the other nurse initialize it. And they'll do their little thing, and they'll do a little pa-pa, and they'll put their little, and I'm like, okay, I'll see you in about half an hour. Never let them know how long it really takes, right? So, at this point, we're in front of the patient. The nurse is off to go do something. All right, so I've got my equipment. I've got my backpack. I'm in the patient's room. I have a moment to start chatting with them right now. There's a couple things on my mind. I got to start putting them at ease. I got to start decreasing the mood, lowering the energy level of the room. I need them to be compliant, right? I've got my procedure timeout, and this is where it really starts to come together, because there's going to be, do you know why I have my own stand? Because there's never enough space in a patient's room. Maybe they have an end table, but if they've been there for longer than a few days, you're not going to have any space to clean up their papers and move their stuff. So in every room, there's an overbed tray and an end table. Maybe there's nobody in the next one. Maybe they're passed out, unconscious, unresponsive, whatever, and you can snatch the roomie's table. But you're going to need to put your site right down, your ultrasound down, and you're going to need to put down your kit. You're going to need your surgical tray. You can try to juggle your surgical tray by putting it up here while you do your procedure. You could try to balance it on the patient's bed. You can try to, you know what I mean? You can try to make it do whatever you want. Let me just say that. But what I'm saying is I built a stand because I do this. So we're going to use that for here. You'll have a different angle of attack. Patient's in the bed. I've got to sort of get stuff off of me. So I throw one towel down on the overbed tray and I get my kit up here. I've got my paperwork up here. I've still got my knapsack on my back. I've got, right, so here's my little roller, and I'm going to start opening this up, and I'm just talking to the patient at the moment. Hey, you know, has anybody explained this procedure to you before? They haven't. The nurses don't know what we do. You know, I mean, the doctor orders it, but the nurses don't know what we do. And I've got my stand, and I'm talking to them. Just you know, what I'm going to do is I'm just going to put on a little bit of music for us, and we're just going to do this. Have you had this procedure before? No? Yes? Oh, you have? Let me just ask. Did the last nurse give you a message for me? Like, don't use this arm, tell the next guy. Like that, because I'll leave a message for the next guy, for the next Picc Nurse. So you get your stand, so you're talking to them, but one of the considerations that you have for this entire procedure is the elevation of this bed. Notice I have not touched the elevation of the bed. The sides are still up. I don't need my patient jumping off because I've lowered the sides early. Everything I do is designed to limit the amount of risk that I take, to limit the amount of risk exposure I have with the patient. Still, just working toward the patient. Now, at this point, I have decided that the patient is going to allow me to do the procedure. And you say that like, oh, but they signed a consent form. I don't understand what the problem is. And yeah, right. So you're going to take your stickers off. You're going to put one sticker on here. You got another sticker. That way identifies the kits on your paperwork. At this point, you have to put down, I have to put down my knapsack. Sometimes I'll get it on the overbed tray. Sometimes I'll start putting stuff on the patient at this point. Right, so I bring in one sheet and 3 towels, and this is why I bring in a sheet. Because patients are dirty and facilities are gross. Oh yeah, so male or female, everybody gets covered by me. I bring them up as much as I can. I mean, I'm here for C. diff. You know what I mean? Like, they're getting antibiotics because they're a digger. They got it in the wound, whatever it is. You already know we're here because they're sick. This second towel here goes over there like their wheelchair because, or whatever chair they have in the room, so I don't have to put my bag down in Cootie World. So I set my bag down on the second towel and I pull it open. I get my little neck. That's the only thing I found that keeps my glasses from fogging up when I put on the my mask. And I'm not going to put on another surgical mask. I'm not going to. I'll wear gloves occasionally, but you don't need to see me wear gloves. I'm not here to teach you how to put on gloves, although we will be discussing gloves. Those are other skills, right? I mean, those are skills you should already have. And we'll still discuss them, but again, that's not really the thing here. At this point, I also break out the speaker, and I just put a little background music on for us. And I just ask the patient, hey, what do you listen to? Hey, what do you like? And I just take a minute and I'm like, oh, The Doors or something like that. Oh, what are you what do you like? And I just, oh, what do you, and at this point, I just have a little bit of background music. And I'm not going to play it for you today because I'll get a strike on YouTube for it. But I take a moment and I Bluetooth it on with my phone, and I just set the speaker right on my knapsack. Board complete. I've got the consent. I've got the doctor's orders. I've taken the stickers off the kit. If the patient has any right or left side disabilities, I'll have documented that already. But we are heading toward the procedure because even though you put the stickers on your board, you still have not opened up the kit. These are 13-gallon Costco kitchen trash bags. Facilities have bags, and I'll use their bags too. Sometimes they have really big ones. That's nice. But I always bring my own trash can, and I like the ones with the little pull handles to tighten them. This bed, too wide for the clip. Some of them will have smaller pinches. Doesn't really matter. I'll just take it, roll up a little bit of the sheet, grab the whole thing together. And now I have my setup trash can. The patient's here. I've got pretty far. I've got my mask on. I've got my glasses on. I'm going to open up this kit. And this piece of plastic's pretty hard. So I always fold it into quarters before I put it in the trash, or it takes up a huge amount of trash. And then it just the trash limits it from expanding, and I just set it on the bottom, and that'll hold my trash can open. This kit now on my table. You know what I mean? It was a wasted kit. It was we had to waste it because the patient went buck wild. So I put on my gloves, 4 fingers, and then I pull them over my thumb. Sometimes my fingers get tired, so my thumb gets tired. So I put 4 fingers in, and then I pull it. Over my thumb and down. Now I've got my gloves on. Now the trick with the gloves right now is you're either going to, you'll have to see. I've decided I'm going to do this side of the patient for the procedure. At this point, you're going to start touching things, okay, but you got to get your patient away from the wall because you have to get your equipment. Now you're always going to check to make sure that your patient has both arms, right? Don't get trapped on the side and be like, oh no, there's no arm over there. Take a moment, take 3 minutes, take 5 minutes of all the time you're going to spend, get the patient ready. Now notice how many times I had to put this thing back and forth to clear that space, but I know that I may have to switch arms. You got to leave yourself the out to switch arms. I had to switch arms the other day. It is not an easy thing. It's a separate video. I'll show you how to switch arms. We got my probe way down here at the moment. That's usually where I keep it. Got it facing me. Got my patient. Got my scrub gown right there. Got my sterile gloves. And at this point, this third towel is going to go under the patient's arm, and I'm going to write. Now here's something that I do. I take a picture of every procedure that I do. So I'm going to write a run number on the back of this, and I set it right here. You know, I've had these made for myself, and it says mid and Picc. And it says the date and the size and the internal and external, because you have to mark every one. But I hate the little thing that they give you, and you got to take your gloves off at weird times to do it. And occasionally, you're going to run into the situation where, after you leave, the patient gets blood under the bandage, and it's totally normal. 1 out of 100. Okay. I'm going to tell you something right now. It is impossible to maintain a sterile field. You can do a fantastic job, and it's a travesty compared to a surgical suite. I won't, when you pull the curtains in a room, God, I don't want to touch the curtains. Like, if you have to, if a curtain even looked at your surgical tray, you would have to. So it is easy for you to focus and be hypercritical of I had one nurse take a 10 mil syringe and fill up one of the 10 mil syringe and fill up one of the plastic things and told me to suck it back up because that's how you pass stuff in a sterile field. And I was like, what the fuck? We're at shithole facility. Look at my patient. What are you talking about? She was a surgical tech for 25 years. So I need you to keep it in the realistic world, okay? And so these came out of the kit. I put it all back together because it makes it easy for me to break it apart for you like this. So these come out of the top. Usually they end up over here for a minute. I get this set up. I bring the white one, the clear one, over here, and I leave the orange one, the pre-procedure one, over here. I sterile field open. The mids come with 3. I don't understand why. The single port Piccs come with 2, and the dual port 5 French Piccs come with 2. You open it up, you drop it in, you do a couple of those, right, and you're going to do your trash drop. At this point, to hit this, you have to have your sterile gloves on. We're going to do everything else up to that point. Now, you can't get an overbed tray in overbed tray in a facility. It's like a buffalo nickel, upside down penny. Just so rare. And you're not going to be able to work this patient like this sitting up. So we're going to have to get down to just one pillow. But not just one pillow. We got to get, as we're getting our patient ready, we got to be able to get their shoulders down. Now the pillow is always going to be like way over here on the side that you want. So you'll get under the patient, and this is really where your gloves get dirty. You get under the patient, and you're going to move the pillow. You're going to get it over there. You want them just a little leaned away from you because it helps open up the angle of the arm. You're also going to start getting them ready. Now, in the facility, you may have a wand like this. You are going to stand right here anytime you raise the bed. And you are going to look to make sure there's no catheter bag, there's no wires. You're not going to fuck this patient up by doing something stupid. Don't ever raise or lower a patient without watching. Where's this? Where's the TpN? Where's their wound tube go? Don't ever pull anything out. I know it's weird, right? Because they've got so much space here with the arm. So I'm still positioning. I'm going to get it out from under the shoulders. I'm going to tuck it up in the neck a little. But it's time for the head to start coming down. Oh, hey, listen, can I lower your head a little bit? You know, you got the tunes going. Can I lower your head a little bit? You're going to be okay? A little bit more. No, tell me when to stop. All right, I can get one more in there. Okay. I'm going to roll this end. I opened it up the long way. I'm going to roll this in. It gives you get a little higher, and it leans their arm toward the open. They're not going to like this. I mean, this is on. There we go. They're not. That's too much hanging. That's too much hanging. I'll also, when you're setting up the patient's arm like this, and you're going to have to let it hang, I always want you to consider that you can't let it just bend at the end of the elbow because it's going to hurt them. They're not going to last through the procedure. When you've got your patient's arm like this, you've got to support it all the way down to the end. You might have to bring it in. If they're hanging off the edge of the bed here, it's too far. You have to walk around. You'll grab them by their bed sheet. You know what I mean? Boom, underneath. Pull them over. Get them a little bit more. Oh, sorry, you have a foot wound. Sorry. You get a couple more inches on the side right there. Pulling them that way, a couple more inches that way. And suddenly they're almost still on the bed. You could look around the room this time and you could find yourself, oh, maybe they have an extra little towel. Maybe they've got a sheet. Maybe they've got a gown that they need to be wearing. And now I've got support all the way to the edge. And I'm telling you again and again and again, take the time to set it up right. Take the time to set it up right. Okay, we're going to, here's a decision that we have to make. Inside is our chucks pad thing and a wow, I don't even have an extra tourniquet. Oh, but I do, I bet you. Nope, that's a pigtail, but I do, I bet. I have it in, do I have an IV kit? Okay. I'm telling you, if you have to walk out to your car because you forgot something, if you have to walk out to your car, I just want you to understand what it costs right now. If you have to walk out to your car because you forgot something. Now, I know it's because I split open this kit. I know. My gloves that come with it, and I don't have that in here because I used it on the patient. But this is what has to happen. I have to put the sides up, lower the patient. I can't tell anybody that I left the sterile kit in a room. My monitor's here, everything's here. And that's just in front of the store. That was 2 minutes. If I had to go through 1100 Hall, out through the front, through the parking lot, oh, you know what I mean? Depending on where you are, it could be 15 minutes. So how did I solve the problem? Because I don't actually have a tourniquet. I got an IV start kit, and I'm going to pull the tourniquet out of that. I have the chucks pad. I always keep extra chucks pad. Chucks pad comes off the top of that. I've gone about as far as I can go. I can't touch my surgical tray now because I don't have my sterile gloves on. But here's the decision that's coming next, all right? And it's a big decision, not this, but hey, can you lift your arm up for me a little? No? Okay, you're just going to tuck it underneath here, lift up the arm, pull it. If you have to, lift with your hand, right, run it up there. Okay. Here's the decision that you really have. You're coming up to the glove decision at this point, and it's a big deal. We've got this all the way up, and we're heading toward a preliminary ultrasound, right? We're going to look to see if we can use this arm. Put a little bit of gel on it, and we're going to find that we can use this arm. And right here is where it happens. You haven't actually got any gel on your hands yet. if you're going to, and there's two ways to do this. You can take these gloves off and put on surgical gloves. You can put on surgical gloves over these. And this is the dilemma that we've been coming to for a while now. I've been touching the patient with these gloves. If I have gel on them, here's what comes next. The sterile gloves go on the outside of the sterile gown. Now, before I started touching the patient, you can put on the sterile gown. It's early. Could you be more sterile by waiting till the start of the procedure? Yes. But right at the beginning, if you go as far as you can, get this lined up right here. So far we've only touched like the bed. We flicked our sheet over the patient. We've got our gown over here ready to go. Before we go and check the arm and get this set up, right now, with the least amount of dirt on your gloves, least amount of patient on your gloves, with the least amount of patient on your gloves, you're going to take your sterile gown, get it clipped on, and this is why. You have to put those gloves in these sleeves. If you get these gloves gelled up, and you get gel on the sleeve, and you roll that gel up your arm, you are going to be so unhappy for so long, the whole procedure. And then when you take it out, get past it again. So you can usually get one arm in, and then I take my, and I get my, right, so now but I do it way back here. Like I'm telling you, you can try to be super sterile, but unless you've got a scrub nurse in the room dressing you, and not a C. diff patient with Hep C, HIV, DE, what is it? There's only so much you can do. I touched my, damn it. There's only so many battles you can have. And look, so far I've been nice to the patient. I've got look at how organized I'm set up, right? I mean, like I just don't miss, and I get it done pretty quick. I couldn't imagine anybody that does it 4 minutes faster than me. I mean, it takes me, I do it so quick. For you, I can do it in 21 minutes. I mean, who cares if you did it in 20 or 19? You'd have to be like, I do it in 16, and I'd be like, how? Oh, I touched my gown again. Okay, anyway. Now that I'm here, I'm going to do my sterile gloves. Oh. Now that I'm here, I'm gonna finish prepping my patient. I'm going to get up under the arm. Yeah, I already know, so I'm going to tie my tourniquet. When I tie my tourniquet, I always keep the shirt underneath there. I don't get gel on your tourniquet. Got my tourniquet. It's not very tight. I've got an ultrasound machine. I don't have to, you know what I mean? I'm not here to... Okay, this is a midline, so I'm not teaching you how to measure. I already know where the vein is, so I'm scrubbing. Boom, I go both ways. I do little circles. I know where I'm going. And out of 1,500, I've had to cut the tip to sample one for an infection. That's it, and there wasn't an infection on the tip. Boom. So you can only keep so clean, but but I try super hard where I can to keep super clean. And you're going to go ahead and drop this in the trash. That's done. You got your tourniquet on. That needs 2 minutes to dry. So what takes more than 2 minutes? Gel on my probe. Drop it back in my kit. Gel on my probe. I've got my glove hands. I wiped the gel off of here before I had to clean it with the chlorhexidine. Kit, sterile dress, sterile drape for the surgery on top. My gloves here. I've got my gown on. I've had minimal contamination. My equipment is ready to go. The probe is at the end of my bed because once I do this, sorry, once I do this, we're in. A little twist, get my fingers in, and pull it up. Second one, same thing. I get my fingers in, drop in my thumb, pull them up. Now I can finish snugging them both up when I have my sterile glove and don't have to look. I'm in. The patient's organized. They've got their tourniquet on. I can come over and grab my sheet, and we've been talking the whole time, right? Just like you and I have been talking. Now this is the patient's right side. The surgical dressing has right and left side. So we'll peel off the right side and set it right in here. I know where I'm going. So, right, lay it down. Give it a little. Now this is called billowing, and it's an accordion fold, and you grab it and you flip it up and you whoop, whoop, whoop. Get it all the way to that last one right there, and you did a good job. I flip it back a little bit. I leave the foot of the bed. I've got it all the way up here. And I take a moment. I always take a moment and straighten out my fold. Roll it up. It says you can unfold it, and that lets you split it over the patient's head. That's fine, but now I'm all over them. This one move to do that gets me all over them. So what I do is from right here, I don't split it. I just roll it, and I just tuck it right there underneath their chin. Keeps their face out. They have a mask on. Keeps their face out. Then you got to readjust this. I've never been able to do it, so you don't have to readjust that. You're going to want to keep it in your open working area. There's a split right here that allows you to get just a little more room. And they're not going to like it if you keep picking it up and down, but there you go. So you got your... Whew. Billowing dressing, billowing sterile field. I've got my, I can come up here. I didn't go digging around in my, yeah. And right now, it's time to do this. I've never seen that tube come out before. You saw me open it up earlier, but now I'm going to turn it. And I'm going to turn it till these two are in the top right corner. This is my closing dressing, my closing bandage. I'm going to set it right there. I'm going to make sure that nothing's about to fall off, because the first thing I want is this. Patient's in a good mood. I use the patient right here as my table. The first thing I do is I pull it open. And you never use this. You'll never have to worry about using that. Those are the needle guides. Toss them up there. It's my sterile gel right here. And the sleeve for the probe. Now the sleeve for the probe comes with 2 rubber bands. You're going to put it on your right probe hand, left probe hand, whatever. Now there's a trick to this. It turns out that I'm just going to put my hand in a little bit. I'm going to keep the bulk of it right here. I'm going to grab the rest of it, and I'm going to pull it through, and I'm going to do it this way. If you do it like this, when you put it over the probe, it's fantastic. The rest of the sleeve falls down all the way. There's like 6 feet worth of sleeve. It goes beyond the bed or anything like that. But for me, that's a pain. It comes like this. If you didn't do it the way I did it, I would do it the way they showed me with the thing like this. However, what I do is I put my hand in it, I take out 3 feet of it, and then I grab my probe and I can pull the rest of it down without having. The problem isn't how long it is, just because it's long. It's how later what it takes to unravel it from here. I do that at the end of the bed, and that way this can dip underneath it. I can stretch it out, and now I'm back on top of my sterile field. with my sterile probe, and when you do the probe, you pull it, fluff the gel up back into the top, and pull it again. You want a nice little pocket of gel right on top of the probe right there. That's why I use both rubber bands, and when I put them on, I hook them, I give it a twist, and I double them up. And I'll show you how to get it off after the procedure. There's my probe right there. Ah, nurse. Ah, my forehead, nurse, we're losing him. Probe. Right up on the field. Okay, right, got my little blue pocket right here. Now that my blue pocket's there, I pick up all my 4x4s, I drop most of them off on the tray, and I put 3 in my blue pocket. I'm gonna drop my lidocaine, and that's trash now too. As I start to set up my tray, one of the things you want to do is capture the glass filter straw, because that is the easiest thing to get caught up on something like this or the blue pocket, and your procedure's over if you don't have a... I should probably have a filter straw in my kit. I dropped one once. I'm going to take the needle syringe for the lidocaine, I'm going to put it in there. Take the cover off my scissors. My 20 gauge needle goes up there. This is the introducer. I make sure the introducer is twisted tight, and it's third in the procedure. I make sure my knife is second in the procedure, and my 21 gauge needle is set in the right of the procedure. And here is my guide wire. I pull 6 inches out, and the blue tip that sealed it goes in the pocket along with my guide wire. Now I'm going to prep my lure lock. Keep your gloves away from the twist, because the lure lock will grab your glove and tear it. And away from your table, you're just going to give it a little bit. Perfect. Leave this one on there. Take your second one away from the table, sterile field, twist it on. Don't twist it too hard. Then, before you do anything, grab where the needleless adapter and the wire guide meets the hub, and make sure it's twisted. A third of the kits aren't twisted and locked in place. Don't lock it too hard. These things you like need a wrench to get them apart. Okay, you're going to put a couple of cc's in, and it's going to start to fill up the tube. I mean, the midline only goes to like right here, right? It's like right there is where it ends. So I'm putting some in the tube, and then I lean the tray this way and back, and the water goes into, the saline goes into the tube, and it activates the hydroprolific barrier on the outside, and it makes it slide in easier. So we're going to activate it. Activate it. Cinch it back down. Do not attach the lure lock. That stays there. And it's time to grab my filter straw. Whenever you pick up anything off the tray, make sure nothing else sticks to your fingers. Grab your filter straw syringe. Break. Open the lidocaine. Hey, don't worry, no, I totally got a shot for you. Here's the thing though, I give you a shot for the pain, but everybody says ow when I give them the shot for the pain. By the time you're done saying ow, I've already got the needle in, man, so don't even worry about it. I got you. Push the air out and twist it into. Now they give you a lidocaine, but they give you a lidocaine sticker, and you could open it up and pull it off. That's okay. You do not have to mark. This is a 5 mil syringe. These are 10 mil salines. You do not have to mark a single-use, isolated barrel, unique barrel for you to do it in this procedure. You don't have to mark it. But single-use, and that's it. It gets right. And you're not allowed to have 2 drugs. 1 drug. And there's a tape measure in here. Okay, I'm approaching the patient, right? It's starting to get, it's starting to get a little closer and closer and closer. This is the right arm, and I'm right-handed, so I'm going to stand to the outside of it. Hey, my name's Jason. I'm here to help you get an IV. Excellent. Listen, I'm going to give you a shot. You're going to say ow, and by the time you're done saying ow, I'm already done with the procedure. I'm going to put some gel on the arm. I'm going to put the heel of my hand on the arm, I'm going to find the vein that I want. And I'm going to lock it down here for a sec. Now maybe there's a freckle or a mark or something else you can use. But with a little bit of gel on the arm, the blue tip from the guide wire tubing can stick right there. And you'll have a bunch of gel. I just don't want to wipe it all up. You'll have a bunch of gel. So you'll take your needle, you'll have to use this, your middle finger, put it on the little needle case on the bottom, pinch the barrel, pull up. Now the needle's clean at this point. You're going to lock it in your hand. There are rules with needles. You lock it in your hand and you keep it away from you until you're ready to use it. When you're ready to use it, you spin it in your hand like this and you watch. You put it down away from you because the patient's going to move. And you come in. What you do not do is this. Gah! You do not take it from blah, blah. You just can't move like that with the needle. So you're gonna approach, and you're gonna come here, and I'm protected. Like I'm bringing the needle to my hand. They're both in this position, so it's hard to get a needle stick. And I'm gonna put the needle in right where the little blue mark is. I'm gonna give. So you only need like 0.5 mil. So I don't. You can't even read it with the thing on the way down and the patient. So I just start pushing. I push. I get a little sub-Q. I pull it out and I'm away. And I've left a little blep in the skin that I can see. I drop my syringe and lock it back into the needle hub because don't activate the safety. What happens if you need it again? There's no extra, right? There's no extra needle. And now I'm grabbing my 21 gauge needle. It's in the sheath. I leave the sheath right there and I hold the needle like this. My hand is still, my heel is still locked down. I've got my mark and now I can watch that. I bring my needle in and below my hand. I'm like this with my probe perpendicular. There's no slack in the bag. And I'm ready to go. Now, in this position, it's a little weird because you can't necessarily see the needle guide lock, but you know where it is right there, and you're pretty close left to right this way, even though it's like weird because you're not tucked into the pocket. Still though, judging by the angle of the needle and how you go in, the steepness and the size of the arm, and you can still get to the needle in the hole on the tip. So I get it, I'm watching it, I can see my needle touching the vein. I push down, I confirm it's not the artery. You can confirm where the artery is before you start. You'll know because you look for the vein. So you got the artery, boom, push down, there's the artery, can't be the artery. Okay, now I'm in. This is a midline. I flick I'm not gonna need that again. I'm in. Now I have not advanced the guide wire yet. For me to advance the guide wire, I've got 6 inches out. It's going to be dripping some blood. The tourniquet's on it, but don't take the tourniquet off yet. I'm going to take my guide wire in, and it should, I'm telling you, it doesn't matter how tiny the vein is. If you got that needle tip in the middle of the vein, this guide wire will go in. Sometimes it'll only go in this much because it runs into some bifurcation or obstacle, proximal to the entry point. And you'll always wonder, can I cut my midline down, and should I get the ultrasound out and double check it to see if I'm up against the far side of the vein? Should I try a different, I don't, if the thing only goes this far, and remember the needle's only this long, so I'm in the vein this much because it was bleeding. I don't use that. I don't, you can't really cut it down. You can't really cut the midline down enough for that, and it's a high risk because if you cut the midline down and it doesn't work for you, you've cut the midline down. What else are you going to do? So I would stop and I would go find another vein if I can't get the guide wire in there. Pretty good. Ooh. Good thing I've got my sterile gloves on. I don't even have a mask on. Okay. Oh my God, that's so much better. $20, eBay. All right, so I've got, now it's in the center of the vein. I'm going to take my guide wire, I put my hand down, I use it like playing caroms on the schoolyard. and I dip the wire into the catheter hub, and I advance it. Whoop! I pull the guide wire sleeve back again, and I advance it again. I pull it back again, I advance it, and I take it off, and there's just a little bit of guide wire. There's just a little bit of guide wire. I bet you I can do this. Well, I got the guide wire in. That's pretty good. Oh. Never set a needle down. Never set a needle down. Never have your fingers in front of the needle. Okay. So I've got my guide wire. In my guide wire sleeve. I'm in. I guide it in with my hand, and we advance it until there's just a tail. Now on this guide wire, there's a little silver spot right there. You should be able to see that. Once the guide wire is in and it's sunk deep, boom, you just pull out the needle, turn this way, drop it right into the needle sheath, flip the tourniquet up, flip the sterile sheet up, pull the tourniquet. You are in that vein and you've got it on lock now. You are okay. Time to do the world's smallest surgery. Grab tool number 2. The blade, the sharp edge is away from me. I rotate it so the sharp edge is away from me. There's no cutting. There's no cutting. I'm going to take my guide wire right up there. If there's any blood, right, I'm just going to clean it a little. And I take it right up against the edge of the guide wire. I follow it to the skin, and I just, boop. That's it. I mean, it's a 1/16 of an inch. It's the world's smallest surgery. Like, I can't even show you how little I use. You're just going to go down a little bit more on black people's skin. They're a little bit thicker. But other than that, it's just a little tiny bit, and you'll get the feel for it. Boop, boop. You'll get the feel for doing it. It'll be just a little bit of blood, and now you're ready for your introducer. You can twirl the wire. That'll open it up a little. Introducer comes off the table. You've already secured the introducer as 2 pieces. Right there, the introducer, and then the vein thing keeps it from bleeding out. Never twist anything with your gloves in the way. It'll always tear your glove. All right, so on my glove, I lock the guide wire. I've got one end of the guide wire on my finger so I can see it. I take the white end of the introducer, the very tip, and I catch it. And it just slides in, and now, hey, you're going to feel me push a little. No, no. You're going to twist a little. You have to make sure it's secure, otherwise the inside piece will push out. You might, and then it'll sink, and you'll just be able to just right up here and get it in the rest of the way. My wire's still sticking out. You need to have this much wire, you know what I mean, sticking out. For just comparison, the midline's only this long. And you don't want the wire to ever end up on the inside, because they're going to have to go to the hospital to get it taken out. They're going to have surgery, and you're going to look bad. When you get the introducer in all the way, you're going to take the hub and back it off a little. It allows the introducer to collapse a little and puts less pressure on the vein. I've got my 4x4 pad underneath it. I usually will tuck it up underneath the introducer at this point. So I've got my the inside tube, the introducer, the split C thing, and my guide wire sticking out like this much. That's where I'm at right now. Everything's going good. I can take a moment. I can turn off my machine so I don't have to charge it, and I can do, you know what I mean? If you don't have to set up your power cord, I mean, that's 2 minutes, 1 minute up, 1 minute down. If you don't have to set up your power cord, every 30 procedures, you get to do one more. Remember, every 2 minutes you save is a free procedure. Every 30 procedures, you get one extra one for free. All right, here is my guide wire sleeve again. Take the end of the guide wire, I'm going to put it right on my finger, slide the sleeve over it, and I'm going to bring the guide wire out most of the way. That's how much I have left right there on this, but I'm going to leave it in there. I'm going to leave enough guide wire so it goes past the tip. And that's because it'll reduce significantly the amount of bleeding that comes out of the tip of the introducer. It's still occluding it way down at the small end. Now comes the midline. I'm going to finish my guide wire, and remember there's blood on the guide wire now. I'm going to grab my midline and my introducer, and there's a swap that's going to happen right now. You don't want to just pull out the introducer because it's going to freak you out how much blood comes out. So you've got the introducer right there, you put the midline in right there, and as the introducer comes out, boom. Take your introducer, and while it's not as sharp, it's still a pointy end bloody thing that went in their body. And then come back, and now I advance my midline. If you have a problem advancing your midline, you can just run a little bit of flush. The guide wire's still in here, but you just run a little bit of flush. Flush up, flush back, push it, move it. Okay, with the introducer here, your midline can only go so far based on the introducer itself. At this point, you have to split the introducer. I'm going to show you, watch. Now, if you're going to do anything at this point, this is not what you're going to be doing at this point. But if you're going to be doing anything at this point, just understand how easy everything, whoa, falls out, whoa, oh, it took it and pulled it to the floor. Oh, what are you going to do to get it back in there? Going to go open up a two-kit Rick? So you've got to be careful, especially after you've hooked up like 4 ounces of solution to it, because it'll drag it right off the bed. The patient's going to get squirrely. Okay, it can only go this far before it gets too narrow to go in. And listen, this is the most genius thing of any pick. So genius. You grab this thing and you break it apart, and it pulls apart. Now, a couple of rules. You are not allowed to just pull it apart because it affects the hole, and it will make the hole bigger, and it'll do damage to the incision. You are allowed to keep it straight, and you can pull it out a little and bring it down, and then you advance your midline again. Okay, couple of things right here that are super dangerous. This wire can flick. Bloop! This wire has blood on it and can flick blood across you. Bloop! It can flick it across your glasses. It can whip you in the face. You could take this wire out and throw it down. It's not even as sharp. But I'm telling you that even if you think you can save 30 seconds, putting this wire back in the sheath and keeping it in the introducer hole and not doing this. Whoa, because it'll, right? Don't work it, don't cold work it. Keeping the wire inside of it stops the bleeding. Keeping the end on it protects you from whipping yourself, or a CNA flinging blood, it protects you. You have enough. It's the same thing with this. Because there's 2 of them and I'm pulling it apart, the opportunity to be like, oh, sometimes the midline won't move, and you'll be able to pull it out exactly evenly with how your splitting it, but the ends, bloop, will flick, and you'll get a drop of blood on your glasses or in your face. They went together to form the introducer back like that, and then they split open, break it open, and pull it out. And what you're left with, throw those up there, they're bloody. What you're left with is the midline in the hole. Perfect. You just advance it a little more. You just reach into their body from behind like this and advance it a little more. The lure lock with the syringe. You're going to have to do a flush. You might as well have it on the lure lock. If you've got blood on your fingers and you just try to pick up this lure lock, it will stick to the sticky blood. You won't have a grip on it, and it will land on the floor. Remember, don't get your gloves caught in the twist. So always keep your lure lock like this. You're going to start to see some blood. It's probably going to be backing up. If they got some hypertension, you'll see even more blood. If you hit an artery, it will push it back out. You'll be like whoop, and it'll be like loop, and it'll be like whoop, and you'll be like, oh, I think I hit an artery. What I do is I pull the tab till the wire comes all the way back here till the end. I've disconnected my barrel syringe. I pull the wire out. I twist it, and I drop it there. I've got my lure lock, right? I've got the hub. And don't get your glove caught. I twist them, I flush, boom. You might be able to taste this. Blah. And down there, I lock and click. Lock, twist and click, twist and click. I always double check the end. Now, machine's off. This is my danger area with blood. It's in the little puddle between the legs. I've got the needle, my used needle in the sheath. I've got my used introducer, what's left of it, in the tube. My knife is safety covered. I did not have to use the scissors. I did not have to use the 20 gauge needle. I just have the two pieces from this and this in my tray. That's right there. Sometimes there'll be a bleeder and it'll take a minute. At this point, whether they're a bleeder or not, I open up the securement kit. I grab the transparent, semi-transparent, I grab the window and the antimicrobial patch. I set them there. This is the StatLock securement device. That's what I'm headed for. There's two things in here. There's the skin prep and the lock. Skin prep is weird. It is a super, you can't tear it from anywhere other than, weirdly, you can't tear it anywhere other than where they started from you. But if you just tear it straight across, goddamn wipe, you can't get it. So you've got to tear this thing down and open to get to that wipe. Now this is not a cleaning wipe. This is not, none of that. This wipe right here is skin prep. So I'm just going to skin prep this area right here. And while that dries, I'm going to take my StatLock. Now StatLock is a danger zone. Hi. Hey, shut the front door. The StatLock is a danger zone because at the edge of the StatLock here and here on both sides, there's sharp points that can get you. The ones inside are kind of made of rubber, but the sharp ones can catch your glove. Also, there's a butterfly flap on the back. Before you stick it to the spot you just cleaned, make sure that the butterflies are in both directions. If you do this and you go to try to pull it, it won't work because you're pulling this side of it. So make sure the butterflies are in both directions. You can put the StatLock on before you wipe it or not. When I wipe it with that little alcohol pad, I'll also take a moment. There's grease on the arm, from the gel on the arm, but I don't usually clean it with the chlorhexidine yet. I clean the spot. I'm going to lock it down with this. And I wiped it clean all the way around with one of the 4x4s. I'll grab the little paddle right there and I'll wipe it clean here as well. But I've still got blood on my gloves. And this is the big consideration because I've got blood on my gloves. When I put the stat lock on, I'm going to get blood on it. There's no way to keep your gloves blood free. And yet, if I take off these gloves and I put the stat lock on with my blue room gloves, well, you really should keep it sterile at this point as best as you can. It's still under here, but what you don't want to do is I'm not ready yet. Unless there's a problem with their arm or something, I'm not ready yet to break this down until I secure it. So I'm going to secure it. It'll say midline. There's two sides. One is barred, one is midline. I push it down, and you're going to have to hold it. Hold it away from the stat. Whatever. If you're going to clip this side first, keep your finger away. Keep your finger away from it because the clips are sharp. Come up underneath it with your thumb. Bring it up. Roll your thumb over. Remove the other side. It's because I'm showing you. It's a weird position. Bring your finger up from the other side, clip it down. Same thing on the other side. Keep your thumb away. Hold it over here. Break it over. Lock it down. Don't get your gloves caught in it. And now you can reach under here and pull it up the rest of the way. Don't leave it on 0. Leave it on 1. I'll show you why in a sec. I'm going to pull one side out, secure it down. Pull the other side out, secure it down. And now I have a midline that's locked into place. Several things can happen at this point. The patient's up, right? The bed's elevated, and you have sharps to drop. If you take off the bloody gloves right now, it's difficult to drop the sharps because you're going to get your next set of gloves bloody too. And we got a couple things we have to do that we don't want to have blood on our gloves, or I don't want to have to do 5 pairs of gloves. So while I'm talking to you, I'm going to drop this. I'm going to tug it down into the bag. And I grab it by the top, just like a little, pull it over the needle stop, and the whole thing comes out. I flip it off I've got this, I flip it off the sheet, and now I've got my probe cover. Right, I'm starting to back out of the room now. Okay, this is where I might tell the patient, hey, there's been a little bit of bleeding. I just want to watch it for a sec. Take a little 2x2, Now, if your patient's not going to move off the bed, and the sharps box is in the room, with my sterile gloves still on, I will pick just the needle up, and I will go throw the needle in the sharps box. I will take the introducer and the knife next, and I will go drop it off in the sharps box. I'll put the 20 gauge needle, I'll put it on the tray, I'll take the tray over to the sharps box. When I grab this, my lidocaine, the bottom is stuck in there pretty good. I grab it both, right? So I'm holding both pieces so they can't separate. I put one finger down and I just twist it up. I've got it locked into place and I drop it in like this. Boop. You could, if you want, take it out and, you know what I mean? You could, if you want, take it out again and boom. But it's in there. For me, I'm okay with staying in there. Drop it in the sharps container. I walk up, I drop this in the sharps container, I put the needle in the sharps container, I drop the lidocaine break bottle, the ampule that I put in the sharps container. Grab the tape, come on back. I got them all, and there's no way to grab that tape without your bloody gloves on. So you throw the whole thing out, right? So it's all put away now. All the sharps are dropped, it's all put away. I've got just this last one, and I've got my patient. Okay, so they're all off. I got my patient here. It looks like that. It's right here. I'm still okay. I will hold it. and peel it down a little bit. I will reach under, I stop completely. I will reach underneath it. I grab it. I watch it as it happens. I hold it down, and I will take this one level. Grabbed my sterile glove. It gets underneath, right, because it's on top of the sterile gown. So I take this side off too, sterile glove, twirl it, and drop it right on there. No blood on my gloves. Still safe and ready to deal with the patient. Now there's going to be blood on this right here. I might have to boop, 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 pull it out of the way a little bit, and I'll fold this under so I don't have to deal with the blood again. I take my tray. This is the sterile cover. I fold the tray inside it. I put it right there. For me, finishing my procedure with my clean gloves, I circle the mid. I write internal 20, external 0, size 4, 1021. I've got that on. Now, we've had some music playing the whole time. Blood has stopped. I have not thrown that away yet. I open up the antimicrobial patch, split it, drop it. This is why you set it to 1, not 0. You put the patch on it, and that gives you the opportunity to set your transdermal patch. I want you to be able to see. Okay, transdermal patch coming. Transdermal patch comes off, transdermal patch has this little strip right here where you can try to write the time, date, and whatever. Forget that, I got my own stickers. It also has this, and this is the chevron lock on it. So, we're gonna peel it off, and I've got it now. The part with the chevron lock, you're going to put on first. You're gonna hold, right? You're gonna hold the lure lock and the clip, and you're going to tuck the chevron right up against there. So you just, the locking clip is in that V. And then you move forward and you lock it down and you seal it. As I finish, I was wiping the arm down. If there's still any gel, after you put the stat lock on, you can always clean the arm again. After the stat lock, before you put the transdermal patch. You don't want any gel left on the arm because it'll keep your transdermal patch from sticking. And you're going to take a moment all the way around the edge. Now it comes time to lift it. It comes off super easy. You loop it all the way around. You'll hold your finger behind it, patting it down. You're really protecting the transdermal patch. All the way around, and it's off. There's your procedure. There's your procedure. And at the bottom, I have my chevron. You let it dangle. It's stuck to my thumb. I grab it with my next finger and I hold it in an arch. I lift up the pigtail and I flawlessly go out of your way to snug it up, because patients are diaphoretic and dirty and sticky. And look at that, look at that, I'm shaking the patient. I've got all that on there. I put my sticker right across the top. I've got the number for the call run below it. I tuck it right under there and I take a picture. While I'm getting ready to lift the chucks pad under, I've got my tape measure ready right at the insertion site. I got 5 at the insertion site. You don't have to do 0. 5, 35 is arms 30. Boom. 30. Now, if you need to remember the trick with the tape is always tear it at 30 and a couple before. So the highest number is what you need to remember. It's 30. You'll get used to the arm. You'll know what it is. You'll forget to do it and you'll know what it is. The patient now has a secure midline. And I still have gloves that are not bloody until at the moment. I'm going to make a little V, capture the bottom, roll it together, and just keep rolling. I've got the tray in there too. And remember this from the sterile sheet that we put on and the sterile gloves? I pull it down, I bring in the edges again, and now this is our sterile gown. I bring this in, fold the top over, fold this side over, and now I've got, this is my whole kit again. Come on. How smooth is that? Costco trash bag. Okay, with the probe, wipe the gel off the probe on their stuff. You don't want, the last thing you want to do is take your sterile, so you got to clean your equipment after the procedure, right? So the last thing you want to do is take your sterile cleaner and fill it full of gel by starting at the top, and then you work down to the bottom and you just spread the gel all along the cord. All right, so I've got my sterile go all the way up. Usually I start by going around the edge of the machine, across the top, then I do this and I hang it. Patient's still up. I've got the bag right here. I still have one pair of gloves on. Before I touch that machine, this pair of gloves comes off. Ah, don't touch me. Loosen it up. My machine goes into my little bag. Roll up my probe cord. I touch this with only my hands to open it up. I touch it with only my hands to close it. And every couple of wipes, I take a moment and I wipe this down. I don't ever touch the bottom of the feet. Then I drop the probe, I drop the stand right in my kit, and that's a midline. I don't have the Sherlock in there. Oh yeah, you want me to tell the nurse? Yeah, sure, I'll tell the nurse. Oh, you need something to eat? Oh, you need your pain pill? Oh, I'll go tell the nurse about the pain pill. Yeah, sure. Take it off, drop it in my bag. I'm gonna leave my glasses on. I'm gonna get my little speaker. I'm gonna check in on the patient. Whew. I forgot my clip once. Oh, never on the patient's bed. Bah. Gloves off, in the trash bag. Everything is dropped. I can just leave this in the bathroom. Boom, by the trash can. My sharps are dropped. You always have to make sure the patient's left in the lowest position and that the guardrails are up. Oh, yeah, you know what? No, I'm going to go give a report to the nurse, and they're going to come in, and they're going to like, blah, 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 blah. You comfortable? Excellent. You know, you slept through most of the procedure. I appreciate that. The music always does. It always puts them out. Not bad, right? And the only difference for a Picc is, and I'll do that with you too, is when you have to go in at the guide wire, you got to put the Sherlock on the chest. But that was the procedure.